Good afternoon, everyone. My name is Nirav Shah. I'm the director of the Maine Center for Disease Control and Prevention. I'm delighted to be joined this afternoon by Governor Janet Mills and Commissioner Gene Wambrew, Commissioner of Maine's Department of Health and Human Services. Governor Mills and Commissioner Wambrew and I are here today to speak directly with everyone in Maine in light of the significant one-day increase in COVID-19 cases that we have seen across our state. We weren't scheduled to be speaking with everyone today, but we felt it was important to speak directly with Maine people in light of the numbers today, as well as the continuing upward trend of COVID-19 cases that we've seen. Before I dive in, I'd like to thank our interpreter, Maura Nolan, for adjusting her schedule to be with us today, as well as our colleagues at Maine Public and our colleagues in the media for their flexibility in making it possible for Governor Mills, Commissioner Wambrew, and I to speak directly with you today. I'll start by providing an epidemiological summary of where things stand before I turn things over to Governor Mills. Right now, in the state of Maine, there are 6,387 cases of COVID-19, representing an increase of 76 cases since yesterday. Of those, 5,670 are confirmed cases, an increase of 77, and 717 are probable cases, a decrease of 1. 146 individuals have passed away with COVID-19, the same number as it was yesterday, and 5,441 have recovered, an increase of 42 recoveries since yesterday. Among our cases are 1,144 healthcare workers, and cumulatively, 484 individuals have been hospitalized with COVID-19. In the past 30 days alone, 33 people have been hospitalized. And right now in Maine, 16 individuals are currently in the hospital, 7 of whom are in the ICU, and thankfully none of whom is on a ventilator. But to put that number in context, 1 week ago in Maine, there were 7 people in the hospital, and none of whom was in the ICU. Today, just in the past week, the number of hospitalizations in Maine has more than doubled. Although the numbers remain low, they are significant. And of note, we have added 7 people to the intensive care unit across the state. Taking a closer look at just the new cases that have been reported to Maine CDC in the past day, we see that there have been some significant and concerning trends. Taking a step back, if you go back to Sunday, there have now been a total of 250 cases of COVID-19 that have been reported to the state from Sunday through today. Just going on today's cases, approximately 21% arise from Cumberland County. York County accounts for 19% of the cases, and Knox and Washington County each account for approximately 12 cases. But those numbers don't really reveal the full extent of spread. Just in the past 24 hours, we've had new cases of COVID-19 in 14 of Maine's 16 counties. Indeed, we've had cases in counties where there were previously very few cases. For example, just in the past 24 hours, we have had 11 new cases in Knox County, 9 new cases in Washington County, 7 in Somerset County, and 3 new cases in Aroostook County. The average age of the cases just in the past 24 hours is 43, but the age range of the new cases ranges from 8 months old to 94 years old. And of the 76 new cases, 14 are among children under the age of 18. In addition, just in the past 24 hours, there have been cases at 8 different schools in Maine and across 2 long-term care facilities. I'll talk a little bit more, as will Governor Mills, about what these cases mean, but to suffice it to say, This increase, both in the number as well as the geography, was significant and concerning, and we wanted to make sure that we were communicating with everyone in Maine directly about this. I'd like to take a moment to provide some brief updates on some of the outbreaks in which Maine CDC has been engaged. Let's start with an outbreak that I talked about yesterday at the Second Baptist Church. Yesterday, I reported an outbreak there consisting of 4 cases. That number has now increased to 27 cases. Now, to be clear, that doesn't mean that there are necessarily 27 new individuals. Indeed, as our outbreak investigation has continued, some of what has happened, some, though not all, some of what has happened is that other existing cases in and around Washington County have now been associated with that outbreak. That accounts for some of the increase, but not all of it. Overall, of those 27 cases, 18 are among individuals who attended at least one service at the Second Baptist Church, and 9 of the cases are among their close household contacts, so-called secondary cases. I'd also like to talk about another outbreak that we discussed yesterday at the Woodland Memory Care Center. There are now a total of 12 cases at that facility, 10 cases among residents, 2 cases among staff. Additional testing remains underway, and we expect that there will be additional cases there, partly through additional testing, but also because of the unique vulnerability of the residents of that facility. And finally, the Waldo County outbreak associated with the Brooks Church. There remain a total of 60 cases. I'd like to turn now to talk about some of the testing data across the state. Our positivity rate in Maine on a 7-day basis now stands at 0.75%. To put that number in a bit of perspective, exactly 1 week ago, that number was 0.5%. And 2 weeks ago, that number was 0.42%. So we've seen a significant increase, both statistically and biologically, in our positivity rate. That being said, again, context does matter. Positivity rates across the country have been rising. And on a nationwide basis, the US-wide positivity rate right now stands at 7.3%. Similarly, testing volumes in Maine have been largely steady. Our current testing volume in Maine stands at 449 PCR tests being conducted for every 100,000 people in Maine. To put that number into context, the national average for testing volume is about 343 PCR tests for every 100,000 people. Overall, what is happening in Maine right now is sustained increasing levels of transmission in communities across our state. We know that because our testing volume has remained roughly the same at a time when our positivity rates and our hospitalization rates have been increasing. It's also important to differentiate how what we are seeing today stands in contrast to what we saw in May of this year. Though the numbers that we are seeing today are roughly similar to what we saw in May, the epidemiological stories that they tell are different. In May, the increase in cases was being driven by focal outbreaks in congregate care settings and congregate living settings, nursing homes, shelters for people experiencing homelessness, and so on. Today, the numbers and the increases in cases that we are seeing are being driven by the fact that the virus is everywhere among us. In May, we were all staying home, so we had very few close contacts. But today, we're out and about, which means that the virus can and has been hitching a ride and traveling farther and wider across the state, from home to home to home. The virus is affecting all of us, everywhere in the state, in every age group, every county, in every walk of life. The reason that we wanted to speak directly with everyone in Maine today is that the risk facing us is one that we cannot ignore. The epidemiological risk right now is that the levels of transmission that we are seeing right now today could quickly turn into exponential growth. Exponential growth is a tough thing to get your head around. It is for me. But what it means in numerical terms is that the 70 or so cases that we're seeing today could, in a few days, turn into about 140 cases per day, every day. And then a few days after that, turn into 300 cases per day for a few days, and so on and so forth. That is the concern that is raised by this increase, and the concern we have around the possibility of exponential growth coming to Maine. That would be the worst case scenario, but it's a scenario that can happen to us. I say that because it is a scenario that right now is happening in other states. Let's not let that happen here. Let's make sure we take this opportunity to get a handle on where things are with COVID-19 in our state. With that, I'd like to turn things over to Governor Mills. Governor, I'm not able to hear the audio on your end. Maybe a bit of a technical. Governor Mills will be back with us in just a second. While we're waiting for Governor Mills to rejoin, I'll provide a little bit more data on some of the other aspects of the cases that we have assigned out and have been reported to us just in the past 24 hours. As I've mentioned, we've seen cases in at least two long-term care facilities. We've also recorded just in the last 24 hours, 7 new cases among healthcare workers across 6 different locations across the state of Maine. I mentioned that of the new cases in the past 24 hours, 8 have been among schools. And Governor Mills, I think you're back with us. I'll turn things over to you.
Can you hear me now?
I can, Governor. Go right ahead. Thank you.
Thank you very much, Dr. Shah. Thank you for these sobering statistics from the last 24 hours and the last 7 days in Maine. Let's put things back in the national perspective as well. According to the New York Times, their database, our country saw 74,410 new cases of COVID-19 just yesterday. Over the last week, the nation has seen an average of more than 73,000 cases every day, an increase of nearly 40% from 2 weeks ago. Something's happening, and it's not good. Cases nationally have reached record levels in more than 20 states. Our mortality rate, the death rate in the United States, is higher than Iran, Iraq, Kenya, Bosnia, Slovenia, Libya, Namibia, Gambia, Zambia, Russia, and China. People are dying at a higher rate in this country than most other countries. We do not have this virus under control. And up until now, Maine and other New England states have withstood the surges of COVID-19 fairly well, compared to other states at least, and other regions. This third surge, as they're calling it, is different. Just over the last week, Vermont has seen a 142% increase in average new cases per day from their average 2 weeks ago. Rhode Island has seen a 105% increase. Massachusetts and Connecticut, 70%. New Hampshire, 28% increase. So what about Maine? Today, as you were told, our state has recorded a high number of new COVID-19 cases. 76 more people in Maine across 14 counties are newly diagnosed with this virus. The last time we had more than that, number of new cases per day, was May 20th, when we had 78 new cases during that second surge of COVID-19. The number of people in the hospital with COVID-19 in Maine has more than doubled over the last week, as pointed out. And the average age of those diagnosed with COVID-19 is 45 overall. Our 7-day positivity rate, 0.75, still among the lowest in the nation, but up from 0.5% a week ago. So these new cases are not caused by one or two large outbreaks that we can identify in a nursing home, a jail, a particular workplace, a church, a wedding, as we saw earlier. Rather, these cases may be associated with private gatherings like dinner parties with friends or relatives, going to social clubs and places where small numbers of people may be gathering. So it appears that we may be following the route of other states in entering another wave of the virus. The question before us now is the same one we faced back in March. Can we control it? And the answer depends on every one of us. We know that we in Maine are not immune from this virus, this silent enemy. We know that COVID-19 thrives on even the slightest hint of complacency on the part of our people. We can't wait until it takes more lives and cripples more communities. You may think you're at low risk, but don't be fooled. Don't be fooled. We know this virus spreads exponentially, like when someone brings glitter to an arts and crafts club and everyone leaves with glitter. We can't put that evil genie back in the bottle once it's opened. This, unlike glitter, is very dangerous, this virus, extremely dangerous. It can make you sick. It can make you sick for a long, long time. It can take your life, no matter your age, your neighborhood, the place you live, or how well you live. It can infect anyone at any age in any town or city or county in this state. And once it spreads, it threatens to overwhelm our hospitals and to sicken our valuable healthcare workers, like the 1,144 healthcare workers already infected by this virus here in Maine since the beginning of the pandemic. 1,144 healthcare workers already infected with the virus. So when you do get sick, whatever risks you take, we may not have enough healthy medical personnel to take care of you and to take care of those you infect. You know, we feel pretty safe here in Maine, and we have a right to be proud of our numbers to date, proud of the cooperation of Maine people. But we're still not doing enough to stay safe. And feeling safe is not the same as being safe. We know what we need to do to get this virus under control so that we can keep our businesses open and keep our kids in school. If we do not maintain physical distancing, wear face coverings, both in private settings and public places, if we do not avoid large gatherings and wash our hands frequently, we will not be able to manage this virus. Lives are at stake here. Make no mistake about it. The economy is at stake here as well. And our ability to keep the classroom doors open to in-person learning, critical to the academic, social, and emotional growth of our children. All of that is at stake. No one wants to undermine the ability of our small businesses to survive. No one wants to send kids home from school again or prevent them from engaging in their favorite sports and activities. So for the sake of teachers who are finally back in the classroom, for the sake of small business owners getting back on their feet, for the sake of the doctors and nurses and CNAs who risk their health to keep us healthy, for the sake of the patient in the nursing home who wants desperately to see that new grandchild in person. Please wear a face covering when you're around other people, indoors or out. Stay 6 feet apart, even when you're with good friends or extended family. Wash your hands frequently. Tell your friends why you are taking this seriously and why they should too. This is about basic social responsibility. It's about avoiding this virus the same as we would be avoiding smallpox that were in our midst, avoiding a car crash, avoiding hurting other people. It's about the freedom of all of us to be healthy and safe and to keep our loved ones healthy as well. It's about common sense. Maine has led the nation in many ways. The question for us is, will we be a beacon of hope to our fellow Americans, lighting the path to life with the virus while we await an effective vaccine and treatment? Or will we be yet another evening news headline about another state crippled with COVID-19? The answer depends on every one of us. The answer depends on you. The bottom line is this: Maine has done well, but we have to do better. We've got to stick to it. We've got to stick together. Many of us are tired and frustrated, impatient. Are there things we all miss? Of course. Do we miss getting together with friends, seeing our coworkers in social environments, having dinner parties, going to diners and restaurants where we might hang out with people? But is it worth the risk? Is it worth it? Many of us are anxious about whether our small business will survive the cold winter, whether your children will learn at their best without adequate internet, whether the daycare down the street will close. But we in Maine are not quitters. We care about each other. We will continue to care for each other. We will not give up. We will not surrender our mutual safekeeping, our responsibility to one another. We've endured so much before, over many decades in our history. The tools to keep this virus at bay, patiently, courageously, at bay for now. The tools are simple ones, not difficult. They're easy for any child to master. Let's do this. Let's stay healthy, stay safe. Thank you, Dr. Shah, Commissioner Labru, for all the work you do to keep us safe. Thank you to the people of Maine for your cooperation.
Thank you very much, Governor Mills. We'll now turn to our colleagues in the media. First question for the afternoon goes to Patty White from Maine Public.
Thanks very much, Dr. Shah. We know that these cases we're seeing now are largely due to community transmission and small household gatherings where there probably isn't much masking or distancing, but what other factors are you seeing that's contributing to the spread? Are you finding it's a lot of people who are asymptomatic, or maybe people that have less common symptoms and so they don't think they have COVID?
Patty, we've just since we've started seeing this increase over the last couple of weeks now, and as we've been thinking about it, looking at patterns in other states, the straight answer is that we haven't seen changes in the presentation, the clinical symptoms, or the patterns of onset of the virus. The virus seems to be affecting and infecting people in the same way that it has for several months now. That is to say, a certain fraction, depending on which data set you look at, remain either pre-symptomatic or asymptomatic. That hasn't changed. The presenting symptoms that people have, be it cough, fever, shortness of breath, loss of smell, GI symptoms, those haven't changed. What has largely happened is that folks were previously congregating in places where mask wearing was the norm. In a restaurant, outdoors where there's a lower risk, places like that. And as they've moved indoors, some of the protective measures that may have been second nature elsewhere, they relax. And I think that's one reason we're seeing a significant spike right now.
Okay, thanks. And Governor Mills, how seriously are you considering changing any of the state's guidelines or taking a step back in the reopening plan? And if you are, can you tell us what specific areas you're looking at first?
I wish I could, but this is not about shutting down something or anything. This is about hunkering down, This is about people getting back in the bunker, essentially, doing what common sense dictates us to do, tells us to do. It's not about my issuing an order today. It's not about my telling people when they can or can't shop or open a business or go to school. It's about everybody using common sense and getting this thing under control.
Okay, thank you.
I'm going to turn next to Patrick Whittle at the AP.
Thank you very much. Just sort of piggybacking on that last question. Feels as though we talk about this with some regularity, but I would like to know if there's chances of revisiting the restrictions on state sort of reciprocity in terms of who needs to arrive with either a negative test or quarantine for 2 weeks. And also it would be good to, I guess, get a sort of a firmer idea of if there's any chance that we could maybe, if the state is interested in sort of revisiting some of the previous phases that we went through back in May and June to sort of slow the spread of the virus at that time.
Patrick, maybe I can answer the question about travel right now, because we look at this every week, every other day virtually. And we're looking at some concerning trends in some of the other states. Rhode Island is still kind of off the charts. Massachusetts is getting a little bit worse. New Jersey, New York, the trends are not good. We're not prepared to change the travel restrictions right now. We have, I think last time I was on the press briefing, I said we highly recommend people coming here from Massachusetts to be tested, to be extra careful. We know there's a lot of traffic in the fall and winter months between Maine and Massachusetts in particular, and you got to go through New Hampshire. You might stop for something in Portsmouth. But and that traffic is understandable. People go to school in Boston. People from Boston come up here to do business. People go to healthcare facilities in Boston and the area. All of that is understandable, the higher traffic between our states in these fall and winter months. But people need to be extra cautious about going back and forth, and extra cautious about what they do when they come back, and making sure they're allowed to get a test under our standing order if they travel in those states. And people from Massachusetts coming up here are allowed to get a test under our standing order, and they should be tested. Not prepared to change that and make it a mandate at this point.
Going to turn now.
Go ahead.
So, turn to Sarah Dedman from the Machias Valley News Observer.
Thank you, Dr. Shaw. Here in Washington County, Calais Regional Hospital is our swab and send testing site. And as you know, they've been carrying a heavy load in recent weeks. They sit on the eastern side of the county, 1 hour away from Machias, where we have quite a few residents, plus the county's largest school and student population. I know the CDC aspires to have testing within an easy 30-minute drive of most Mainers. Should an outbreak occur in this area or at one of our schools, is there anything the CDC can do to stand up easy access testing here?
I think I'll answer that question. We are working aggressively right now on 2 different fronts. First of all, finding existing sites in places like Machias where we could open up a swab and send. We're in active discussions on that right now. We also are working on mobile testing options for schools so that if a school does have an outbreak, we can figure out ways to bring people to the school to collect samples to send to our state lab to ensure that we have testing in the area. So this is an ongoing work that we do every single day throughout the state to try to make sure that people do have access to testing. And we are hopeful that we will be able to, at a minimum, respond to an outbreak, but also set up a site that will be open regularly in the area.
Thank you.
Thank you.
Next up is Joe Lawler at the Press Herald.
Yes, I have 2 questions. One is just getting back to the COVID restrictions. And this question is for Governor Mills. What are your thoughts right now on the reopening of bars next week? And could that possibly be curtailed or delayed based upon what is going right now? And also indoor gathering limits. And I guess just kind of more broadly, like if part of the reason why we've been so successful is these restrictions and rules, then why are we opening up?
Thanks for the question, Joe. Opening up is a kind of an odd term in my book. What we've done is allow activities to occur and encourage many activities to occur, because many of the things we're allowing are healthy things and keeping people sane, for crying out loud. But we're looking at each one of these sectors and each one of these capacity limits and guidances that we put out, looking at those regularly. I don't have an answer for whether anything's going to change in the coming weeks or months or even days. It's just something we're looking at every day. You know, we have rules of the road, rules for all kinds of things. And I think that businesses in Maine have been incredibly cooperative, with very, very few exceptions. The businesses, large and small, retail, hospitality, service sector, all the businesses have been incredibly careful for the sake of their own employees and staff and for the sake of their clientele. And honestly, because we've done so well, more people are coming to Maine and doing business in Maine, and our figures are much better than expected, to put it that way, both revenues and ongoing business. So I'm pleased with that, and we want to keep that trajectory. We want to keep businesses doing what they do, all sorts of businesses, but also further encouraging their clientele and the members of the general public and the staff and employees of those businesses to keep on guard, to maintain strict health precautions. Don't go to work if you feel sick. Take temperatures of people coming into businesses and staff working there, all those kinds of things. And the precautions we just talked about, washing hands, sanitizing places, and which most people are doing anyway, but keeping the distance. It is so easy to walk into a store and see your old friend and classmate down the aisle and go, hey, and you want to give them a hug, you want to invite them over for dinner or a drink or something, and you just got to say, not now, not yet. Not now, not yet. And they understand that. They're living in the same culture, the same environment, under the same precautions.
And I'll add one other note that given, again, what Governor Mills said about public spaces, we do appreciate the partnership and the work that Maine people have done to protect themselves and their neighbors in public spaces. We want to underscore private spaces matter as well. When you're in social gatherings, when you're in private spaces, COVID-19 knows not the difference between whether there's 10 people together in a public space or a private space. So we do want to remind people that as we look at what we need to do now, a large part of that is making sure that we extend into other settings, not those governed by these guidelines, the basic public health measures that have kept Maine safe to date.
I'll just add,
thank
Joe,
you.
I know you had a second question, but I'll just add to build on top of what Commissioner Lambert said and Governor Mills said. For months now, for years, decades, eternities, home has been viewed as a safe haven. There's not a safer place in the house than the kitchen table. But as folks are moving inside, I think folks are letting their guard down because the home is now being a source of risk as gatherings are moving indoors. So it's just as important as ever to take the same steps you might take if you were elsewhere at a commercial establishment when you've got friends coming over to home. So sorry, Joe, you had a second question.
Okay, yes, thank you for that. My second question is just the outbreak at Second Baptist Church and the increasing cases in Calais and Washington County. Do we know yet whether any of that is connected or possibly connected to the Brooks Pentecostal Church outbreak? Thank you.
Yep. Joe, at this time, we have not identified a linkage between the cases, either at those associated with Second Baptist Church, 27 cases, or more generally in Washington County. We've not identified any linkages between those and the Brooks Pentecostal Church in Waldo County. I'm going to turn next to Allison Ross at WMTW.
Hi, thanks so much for taking my question. So my question is regarding schools. We're saying that there are a number of cases now at these schools. Will this change school sports? Is this going to impact their guidelines?
So we update our health advisories for school learning that is either in-person learning altogether, hybrid or remote, usually every other Friday. So we will be looking at these new data with regard to school-based learning. We also do say that in areas or counties that are yellow, we recommend against the types of interaction in sports, competition, scrimmages that could otherwise cause transmission. At this time, we have not changed the color advisories or the health advisories for our counties, but that typically does happen on Friday. So we will be looking hard at the data, and any updates will be posted on the Department of Education website on Friday.
Allison, I'd like to underscore that there are not 8 outbreaks at schools. These are discrete single cases that have been identified and associated either as a student, a staff member, a teacher that happened to be at the school. These are not 8 outbreaks at schools. I just want to be really clear about that.
Great, thank you.
Thanks. I'm going to turn next to Don Kerrigan at News Center.
Hi, Dr. Shaw and Governor Mills. Governor Mills, I have a couple of politically related questions for you. One is that we're expecting at least one more presidential campaign event in Maine. I believe that's tomorrow, where it's anticipated there might once again be a large crowd. Is the state doing anything preemptively to communicate with that site, the business hosting this, about controlling crowd size or any other measures that are anticipated to reduce the size and potential congestion of any crowd?
No, the other day, we reached out to the White House to see if they would like to converse and discuss with us what the ramifications are of large gatherings in Maine. That didn't happen. We did not hear back from them. So no, I have not had any discussions with that particular business, wherever it is. You know, and I know people are anxious to show their support for candidates at all levels in all kinds of ways. And it's an interesting time of year and an interesting election year, pretty heated at a number of levels. But in this case, in this day and age, with this virus lurking around every corner, all I can do is admonish people, discourage them from attending any large gatherings. I know, I ran for office, obviously. I loved large gatherings. I like to see a big crowd, and it pumps up the candidate, it pumps up your supporters. It's a natural thing to want to do. This is a different time. This is a whole different environment this year at this time. And I would just discourage people from attending large gatherings if there aren't precautions in place. Keeping distance from other people, keeping a face covering on, no matter where, no matter what, even if you're 6 feet apart, just taking the precautions that we've been talking about all along. I don't want to see the virus invade this state to any greater extent than it already has. Again, once this evil genie is out of the bottle, you can't put it back in. And that applies, my concerns apply to gatherings of any sort, at any level, private or public, whether it's a school-based gathering, a church-based gathering, a political gathering, a social club, any kind of gathering. Even when you're seeing old friends you know so well and you see them every Saturday night normally, or you want to share a spaghetti dinner, you know, we just can't do it now. We shouldn't do it now. So I would just, again, reiterate that caution about gatherings of any sort. I've said it before, I'll say it again. This virus doesn't know, doesn't care whether you're a Republican or a Democrat or independent or green. There is no Democratic virus or Republican virus, and we're not turning the corner yet. We haven't got this licked.
And the related question is, the governor of South Dakota was here today as part of a Republican group for the Trump campaign. And a reporter there told me she was quite critical of you and for the restrictions that imposed on Maine earlier, claimed that a governor doesn't have the authority to impose the restrictions you did.
I'm sorry, she didn't tell me that, so sorry we didn't have a conversation because I like her personally. And I don't want to talk politics, but I will say that the statistics in South Dakota give her no reason to brag, no reason to boast. When you have an average of 900 new cases a day, and they have smaller population than Maine. I don't know what she's doing in her state. She hasn't asked for our advice. I'm not going to give her advice, but I don't think she's in a good position to give us advice.
Thank you.
I turn now to Amy Brown at WERU.
Thank you, Dr. Shaw. Just real quickly, did you say that the 7-day positivity rate in Maine is 0.75%?
That is correct.
Okay, great. Thank you. And I asked about the updated numbers on the CDC website for Waldo County and the search by zip code feature last week, I believe it was. And after that, they were updated, but only to October 18th, which is right at the very beginning of the outbreak. And I've since heard from a listener who was watching numbers in, I believe, Hancock County, who said that they haven't been updated. Will that be updated again soon to reflect all the new cases, or is it just done every 2 weeks regardless?
We do that on the normal schedule, but we do anticipate doing that next update, if not later this week, then early next week. We also do sometimes build in a deliberate delay in order to protect privacy. So we try to space out any updates if the numbers are small so that any individual can't connect a case with someone who they may have known in a zip code who was sick. We sometimes do that according to a privacy protocol, but in this situation, we do anticipate updating the zip code data, again, if not later this week, early next week.
Thank
But
you.
it's important to note, Amy, that if you are listening or watching right now, and you're making decisions about what to do or whom to have over to your house or whether to go out based on zip code data that are on the Maine CDC website, that's not the way to go about doing things. What we've seen in the past week, in the past month, and certainly today, is that the virus is in every single corner of the state, every zip code, every county. So while the zip code data are interesting and informative, they are not a tool for individuals to calculate the risk of engaging in certain activities. We should be going about our days as we've recommended for months, which is that the virus is everywhere around us. And one quick update there, Amy, the zip code data have now been updated through October 25th. And that update was done today as planned.
Great, thank you. And I don't know, I think this next question is either for Commissioner Lambrou or Governor Mills. Why has no legal action been, or why was legal action taken against the Big Moose Inn, but none has been taken against the businesses who've been hosting these large campaign events with no distancing or masks?
You know, the enforcement questions, we work with the Attorney General's office and law enforcement locally and statewide on any enforcement issuing. I guess I have to say it depends in part on what the response is from the person or the entity supporting the gathering or the apparent violation. You know, our main goal is to make sure people, individuals in the state of Maine, accept their own social responsibility, their own responsibility to protect themselves and protect other people, including their own loved ones, family members, and community members. So it's a tough job to get that message out constantly when there's such enthusiasm for different things, including going to church, including going to a social club, including going to a political rally occasionally. That's out there. And I was pleased to hear from the apple orchard, the proprietor of the apple orchard the other day, who sort of apologized for having a large crowd at his business and hoping that they could continue implementing the precautions that they have been apparently all along. So we engage with these interest groups and these businesses, and we consult with the Attorney General's office whenever we think it's bad enough that we need to sort of bring down the hammer.
Yeah, and I'll add that we did issue this imminent health hazard at Big Moose Inn because it continued to have guests. It continued to operate a restaurant. When there's repeated risk of exposure, we do follow action, and we threatened to suspend the license so we don't see continued ongoing compliance challenges. Again, mostly these organizations have come into compliance, which is the point of our enforcement scheme, to try to protect people. But there's a different circumstance than the one-time rally that the governor just discussed.
So if the rally that's coming up tomorrow in Herman is at the same place the last rally in Herman was at the same business, would that be a cause for action?
I'm sorry, is it the same business? I don't know.
I don't know yet either.
I'm not aware. And we can't speculate about what might happen tomorrow or next week or whether somebody's going to be in a violation. We expect compliance. We hope for compliance because otherwise this thing is going to be totally out of control.
Thank you.
I'm going to turn now to Charlie at the BDN.
Yep. Hi, Dr. Shaw. Thank you. My first question is about Calais Regional Hospital. We have heard that there may be some staff there who have tested positive for COVID. Can you confirm if there is an outbreak investigation starting there?
There is no open outbreak investigation at Calais Regional Hospital.
Okay. And then I guess I'm trying to think how to explain this. So Maine has kind of been reopening portions of its economy and loosening some business restrictions. And now, that's a clear change from what happened sort of, last spring and over the summer. And now we are seeing these big new case numbers. And I guess, we hear what you're all saying about compliance, and it would make sense that if people wore masks and stayed socially distanced, the virus would not be spreading. But do you think a lot of these new cases are just from people who aren't following any of that advice to wear masks and avoid gatherings and that sort of thing?
Charlie, it's difficult to say. What we can go on is based on what people tell us, what they tell our case investigators as we investigate each and every case. And what we've seen from those, as well as trends and data that have been reported nationally, is that individuals are now congregating indoors more, where, let's face it, if you're in your own home and if you've got some friends over, you're less likely to be wearing a mask. We're intending today's discussion to be a clarion call for everyone that no matter where you are, no matter if you're in your own home, at a friend's home, the virus can still hitch a ride with folks and cause transmission and infections in those spaces. So if folks have been wearing masks indoors at their friend's house, that's great. Please keep doing so. But if you haven't been doing that, if you've not been spaced out when you're at your friend's house, please let today's data serve as the clarion call to do so.
Okay. Sorry, just one quick follow-up from that. I know you're just talking about what case investigators are finding. Are there any trends that are emerging in where some of this, where this community spread is actually happening? Is it in people's households or restaurants or any place else?
Well, we were just talking about this morning with the epidemiology team, and there have been two initial trends that have emerged, and I'm leaving aside now the outbreak associated cases, leaving aside the cases associated with, say, the Second Baptist Church or the Woodlands Memory Care Center. If you exempt those for just a moment and look at the discrete individual cases, the two things that case investigators have learned is that transmission, or the likely source of transmission, is in small household gatherings, friends' houses, or small groups of people that have gone out to eat during the time which they may not have had masks on. This is now just based on a couple days of data. So clearly we need to get a better handle on what might be happening. That in an outbreak setting or in a pandemic setting takes additional analysis. That's what our case investigators do as they continue to interview people and aggregate all the data. But that's been the early read based on a couple of days of investigation.
Thank you.
I'd like to turn next to Steve Betts at the Courier Gazette.
Hey, Dr. Shaw. I have a couple questions concerning Knox County. The outbreak at Woodlands of Rockland, has that been tied to any other outbreaks in Knox County or elsewhere?
Steve, that's a question that we're investigating. It's top of mind for our investigators, given the obvious outbreaks that are going on in Waldo County. At this time, we have not found a direct link or even an indirect link between Woodlands and anything that may be happening in Waldo County. But please know that we are keeping our antenna very high up for any possible linkages between Woodlands and anything else going on. At this time, we haven't seen it, but that doesn't mean it's not there. It just may require more data and more digging.
And also you mentioned individual, I'm sorry. Go ahead.
No, Steve, I was just going to say, I'm glad to see that your office is more cluttered than mine.
That's my kitchen in the back. And in terms of the individual schools, have there been cases found in schools in Knox and Lincoln counties?
Steve, we will be updating the Department of Education's website with the latest data on all the schools in Maine that have recorded cases or a case. That data should be updated tomorrow. That will reflect the latest of where every single school is, be it Knox County, Lincoln County, or anywhere else in Maine. That'll be the best place to check that.
Thank you, Dr. Shaw.
Going to turn now to TJ Tremble at ABC 7. And hey, TJ, you are on mute, sir. TJ, you're still on mute.
There. Okay, I thought it was my wife talking to me, putting me on mute. Anyway, this is for Governor Mills, I believe. Governor Mills, with all of the exponentials that Dr. Shaw was talking about and the way that he's projecting that the number of cases will multiply, as he says, exponentially, is there a magic number that might be hit for you to say, okay, it's time to walk back on this, and some of these restrictions, restricted guidelines have to be put back in place?
Right, magic numbers, no, but we look at all the data, all the metrics, holistically, whether it's looking at the trends in Rhode Island, Connecticut, Massachusetts, New York, New Jersey, et cetera, or whether it's looking at whether there seems to be spread in a certain sector of the economy or certain kind of gatherings, those kinds of things. We're looking at this every day, and no decision has been made about moving back. Nobody wants to further restrict people's liberties. Nobody wants to tell people they shouldn't go to a gathering. Nobody wants to tell people that they may not be able to eat at their favorite restaurant because of the capacity limits. They may not be able to go to their favorite store as quickly as they otherwise might, or they might have to stand in line outside for 5 minutes. Nobody wants to do that, but it's part of the overall responsibility, part of our overall campaign to keep people safe, to have the guidelines in place and to make sure people and businesses and activities comply with those guidelines as much as humanly possible.
And
TJ, if I could offer just a very quick clarification on top of what Governor Mills noted. We don't know whether there will be exponential growth. That's not a projection. That's not a promise. It is a possibility. It would represent the worst case scenario of what might happen, but very important to note, we have an opportunity to put a lid on things and prevent or reduce the likelihood of any such growth. But that was not a projection, not a firm model. It's the worst case scenario of what could happen based on what we've seen unfold in a couple of other states. Sorry, I just wanted to be really clear about that.
And by comparison, exponential growth is what we see, for instance, in South Dakota, where they've had a 40%, more than 41% increase in the daily average from 2 weeks before. They only have 900,000 people, and yet they're seeing 900 cases a day, new cases of COVID. That's exponential growth that we want to avoid.
I'll also just add that South Dakota's positivity rate is 40%, 40.
Thank you. Can I just throw a question at Commissioner Lambro? Commissioner, just to play devil's advocate for a moment, if you know that there's going to be a political rally and that may have the likelihood of attracting thousands of people who may or may not be wearing masks and practicing social distancing, do you have the authority to go in it ahead of time and say something to the effect of, if you exceed this, there'll be a penalty?
We do have a system to try to warn, give information and give warnings where there is a risk. We have been doing that when we have clear information that there will be a gathering this large. We do this with all sorts of gatherings, be it potentially large weddings, large religious gatherings. We previously have been hearing about in the summer different outdoor gatherings that could exceed the limit. Our practice is if we have information that there is going to be a gathering, we provide the rules, the guidance, the information to the organizers and encourage them to follow that. As Governor Mills explained, then we turn, if there is a violation of that, to the Attorney General and our different statutes to see, depending on the circumstances, what are our options.
Thank you.
I mean, you know, TJ, we're not the COVID cops here. We're not trying to regulate everybody's behavior, far from it. We provide the best advice and counsel and recommendations we possibly can based on science and medical expertise. And, you know, it's like we have rules. We have rules about driving. You're entitled, you have the right and freedom to get a driver's license and drive up the road. You don't have the right or the freedom to drive all over the road because it imperils other people and yourself. Do police officers go after people who weave once or twice across the line? Not usually. It's when somebody has repeatedly weaved across the line, or when somebody has risked the life of other people on the road, or when somebody is drunk and weaving. That's when we start enforcing the rules of the road in a more direct sense. The rules are there, but there's still an individual responsibility on the part of every one of us in this state. It's part of your civic responsibility to help take care of other people in this state. And that's why we ask people to follow these guidelines and to follow the rules for the health and safety and protection of everyone else, including yourself and your family.
Thank you, Governor.
I'm going to turn next to Greg Lagerquist at GME.
Thanks very much, Dr. Shaw. Thank you, Governor Mills and Commissioner Landrieu. A couple of quick follow-ups to what people have been talking about here. Civically, we've got some events coming up this in the next week. We've got the election, and it seems like those who haven't voted by now, implication would be that they plan to vote at the polls. And two, Halloween on Saturday, which would seem to be an event where there's going to be a lot of potentially gatherings happening in those home settings where you said is starting to occur. Any specific messages around the election for those who may be voting on Tuesday and around Halloween on Saturday?
Well, don't combine them. That's all I can say. But
take them one at a time.
As you know, several 100,000 people have already voted absentee in person or absentee by mail or absentee by drop box. And I'm delighted with the response of people in Maine voting in advance because we've been very concerned, and we were concerned during the primary about the health and safety of poll workers, about health and safety of other voters in general, and the health and safety of the population at large. Things went pretty well during the primary, but now the general election or the presidential election at the top of the ballot is generating a lot more interest and a lot more people to vote, wanting to vote. You know, we want people to vote. We want them to do so safely. So that is why there will inevitably, if you go to the polls to vote on Tuesday, instead of voting beforehand in person at the town office, or dropping your ballot off in a sealed envelope signed by you in the drop box. If you decide to go to the polls, nevertheless, there will be lines, there will be 6-foot distances, there will be markings. You will be asked to wear a mask, a face covering, in order to protect those who are working at the polls and those others gathered at the polls to vote. So there are precautions in effect, and we've had many conversations with Matt Dunlap and with the clerks across the state. They're very concerned about gatherings at the polls as well. It's another reason we in my executive order, we allowed them to start tabulating those massive numbers of absentee ballots a week in advance of the election to get that work going before there's a crowd coming into the town office and the polls. Halloween, I don't know. I know that Nirav and Jean discussed Halloween on an earlier occasion, and I don't have any particular suggestions.
Greg, there is guidance that is available for everybody that provides great tips on how to proceed with Halloween in a manner that's safe for you and your family. I think the goal is to keep your bubble tight, minimize your exposure with others. The same things that we've recommended, just adapted for the day itself. Halloween can happen, but we've just got to make sure we do it in a safe way.
Great, thank you.
All that being said, Greg, we're really focused on what's happening as well right now today. I mean, we want to talk to everybody today, given the data that we've just seen in the last 24 hours. That's what we're really focused on, but we're also looking ahead to events that are happening this weekend and next week. And the final question of the afternoon goes to Emily Tadlock at WABI.
Hi, thanks so much for taking my questions. The first one, I just want to be clear because we've asked some questions, and I just want to make sure I'm nailing the nail on the head. Greenway Equipment Supply in Bangor is where Don Jr.'s event is going to be held tomorrow. I just want to know if anyone has talked to them, and I'm assuming no one has, considering you guys weren't exactly sure where this event was happening tomorrow. Is there going to be anyone talking with them about how many people should be at their event?
We'd be happy to talk with them. I'm not sure that they've reached out to us. I'm not sure whether anyone else in my office has tried to reach out to them, but we'd be happy to talk with them. Because regardless, whether you support one candidate or another, you don't want to get sick by having attended a rally for a candidate. You don't want to attract the virus and infect other people by virtue of having gone to a gathering of that sort. Shouldn't happen. It's preventable.
Jean, I don't know if you want to hop in on that, just because you had said before that when you did find out things like this were happening places, it's your prerogative to reach out to them.
We'll just add that we're happy to follow up and verify if this is the case and communicate with that organization.
Okay, so then my next question, Dr. Shaw, is for you. Many people have been commenting on the coronavirus number updates that we do every day, saying that as our testing increases, our cases are, of course, going to increase. So I was hoping maybe you could clarify for people how much of this current increase we're seeing right now is due to testing.
Sure. I'm glad you raised that, Emily. There are various epidemiological models that help sort of sort out whether the increases in numbers you're seeing, what percentage or what degree of those increases are being contributed to by more testing or actual growth in cases themselves. And without going into all the nitty gritty, what I will say is that what we've seen in Maine is that some of the metrics around testing, the volume of testing, the location of testing, those numbers have been holding relatively steady. But what we've also seen, so you hold that variable steady. And then we've seen other changes, such as our positivity rate going up and now hospitalization rates going up. That constellation of findings is extremely strongly suggestive that the new cases are not being detected because of more testing, but rather are occurring because of more transmission. There have been earlier time periods in the pandemic in Maine when a larger fraction of the new cases was because of more testing. But what we've seen in the last, say, 96 hours is not so much more cases because of more testing, but more cases because of more transmission. Now, let me be really clear. The testing architecture that we have in Maine is very strong. Even though we've seen an uptick in our positivity rate, it is still amongst the lowest, if not the lowest in the nation. That puts us in a favorable position to be able to detect more and more and more cases. That's a good thing. It means we can detect those cases early and work with those individuals by our case investigators and contact tracers to give them advice to stay indoors and limit transmission. So testing remains as critical as ever. But what we're seeing just in the last 96 hours is much more a function of more transmission, not necessarily more testing as it stands right now.
Okay, thank you. And then I had one more question just for Commissioner Lambrew. You mentioned earlier about you guys were starting to work on more testing sites, and you mentioned testing at schools as well. I was just elaborate on that a little bit.
Sure. So we have in the past, for example, at Massabesic Middle School, we brought some of our resources to collect samples to a 2-day event at that school. We also, when Sanford High School had an outbreak, sent some of our Swab and Send mobile sites to that site to collect samples. We're trying to get that into to be set up as a more regularized activity or option for schools. In addition, we are working on a plan for the Binax Now rapid tests, which the administration has given to states in part to give to schools, to support schools for rapid testing. So we're working on all those details and expect them to have all those details out soon.
Thank you.
Great. Governor, that was the last question. Before I turn it over back to you, if I could just make one brief mathematical note. There have been some differing views about the number of cases that we've had today. And I just wanted to take a very brief moment to clarify that. There's been some reporting that the number of cases today has been 87. As I mentioned a moment ago, our number is 76. Just wanted to explain where these numbers come from. First, Maine CDC, since the first day we reported cases, has not changed the way that we report, catalog, analyze, and discuss the number of cases. We've been doing it the same way since day one. The number that some folks have put forth is the number of cases, 87, that were assigned out for investigation since yesterday through 57 minutes ago. And as case investigators have reached out to those 87 folks, they have found that, for example, some of them were probable cases who it turns out have tested negative, as one example. And so the number of cases that are assigned out is actually different from the net number of new cases. Our view at Maine CDC, and the view that we have taken since day one in the outbreak and with every other infectious disease, is that the net number of new cases is the one that we focus on. That number is 76, and that's the number that we base most of our analysis and our actions on. I just wanted to offer that quick methodological note. With that, Governor Mills, I'd like to turn things back over to you.
Thank you, Dr. Shaw. And I think one other thing you mentioned earlier was the age range of those people who've been newly diagnosed with COVID. And I think you said the average age is 43. But within a broad scope, and the range was 8 months up to 93 years of age. 8 months up to 93 years. That takes in a huge range of people. And it says to me, and I should say to everybody, anybody can get this virus. Anybody can get sick from it. Anybody can be hospitalized with it. Anybody could be very, very ill from it, and people can die. So I think, we've focused a lot on politics today. A lot of the questions were about political rallies. I would ask people to put their politics aside and consider this to be a matter of individual responsibility, to think before you take a risk, think before you decide not to put on that face covering, before you decide to hug a person you haven't seen for a while, before you decide to go to a gathering or have a dinner party where it feels okay to take your mask off for an hour or so at a time. Before you decide to do that, think about the 8-month-old child who's sick with COVID right now. Think about the people in nursing homes who want to visit other people and want to be visited. Think about the nurse, the CNA, and the doctor who are tending to some of these patients and many others and trying to come home themselves to a healthy family in the evening. Think about the wait person, the waitress, or waiter who serves you coffee in the morning at the local diner. Are you putting them at risk? Are you putting the person around the corner at risk? Think about the daycare provider who's trying to take care of so many kids and let those parents be able to work and keep our businesses surviving and going strong. Think about other people first and foremost. If you don't think about yourself, at least think about the other people in Maine whom you may be putting at risk. And thank you to the Maine people keeping your chin up, keeping your courage up, being so incredibly cooperative. We've done so well so far, so well. We can keep it up. We can do this. Thank you.
Thank you very much, Governor. Have a good afternoon, everyone. We'll catch up again tomorrow.